Good afternoon and welcome again to the St. Clair County EMA office for our daily briefing. We've got some more numbers for you today. Sam Behrman from the Health Department is with us. Sam, welcome.
Thank you. Thank you again for having us. As we have done in days past, the numbers that we will report to you today for St. Clair County are those St. Clair County residents that have been tested. We are now at 615 residents that have been tested, 86 positive, which is an increase of 4 from yesterday, which is a male in his 30s, a male in his 40s, a male in his 60s, and a female in her 20s. We are now at 389 negative cases, 140 pending results, and we are sad to report that we are now reporting 4 deaths. So that is an increase from 1 of yesterday, and that is a female in her 70s who did have underlying health conditions. For state totals, we are at 62,942 that have been tested. We are at 12,262 positive, which is an increase of 1,006 since yesterday. We are at 307 deaths, which is an increase of 33 since yesterday. As always, our thoughts and prayers go out to all the families that have lost loved ones in the fight with this virus, as well as the healthcare providers that have cared for them. Now, one thing I would like to go over before I turn it over to Chairman Kern is that even though we only have 4 new positives in St. Clair County as of today, we have over 1,000 new positives in the state. So, we need to keep that in mind, along with the fact that we have 140 results that are still pending. As we've said in days past, that 140 tests that are pending could go, a lot to the positive side or a lot to the negative side, hopefully to the negative side. But keep in mind that our numbers change drastically and can change drastically every day. One thing I would also like to mention with the state report of numbers versus our numbers that we report daily, when we do these daily briefings through EMA, the numbers we report to you are what we have up to the moment. And as we receive results, we add those into our numbers. And when we receive results from St. Louis hospitals and St. Louis testing facilities, we add those into our numbers as well. So just keep that in mind when you look on the Illinois Department of Public Health website for their numbers versus ours. Sometimes there can be a difference, and that is just the difference in what has actually been reported to us as positive and negative. So that's the difference. So now I will turn it over to Chairman Kern for his update.
Thank you, Sam. As we've heard, another tragic death due to the COVID virus. This virus is changing the way we live currently and certainly our future. So we want to make sure that we're doing all of the things that we're told to do. Stay home, wash your hands, practice good social distancing if you have to go out. All these things are extremely important to make sure that we have as few deaths as possible and as few people who get this virus as possible. The IHPA has listened to the state, to the residents, and we're now allowed to release by zip code as long as that zip code has above 5 people who have tested COVID positive in those zip codes. So for the first time today, we'll discuss our zip codes, and I'll just release the zip code number and then the number of COVID positives in the zip codes. In 62206, there are 6 positive cases so far in St. Clair County. In 62223, there are 8. In 62208, there are 9. In 62221, there are 12. And in 62269, there are 8 COVID positive cases that we have been made aware of. So those are the numbers for now. If you live in another zip code, that doesn't mean there isn't a COVID positive person or persons living in that zip code. It just means that your zip code has not gotten to the level of 5 or above yet. So that is currently how things are being released, and we look forward to every day being able to provide that information to you. Joining us today is Erin Hazen. Erin is the nurse manager of the Emergency Department and Urgent Care for HSHS St. Elizabeth's Hospital. Welcome.
Thank you.
Thank you for being here today. Are you worn out?
Not yet. I have a team that's doing the legwork, though, so they're supporting me.
So speaking of your team, When you see St. Elizabeth's Hospital and how it's geared up for this event, you now have a triage tent at St. Elizabeth's. Can you talk about the process, the triage tent process, how people access that, what its purpose is, how it changes the way you're practicing medicine at your hospital?
Absolutely. Coronavirus has definitely allowed us to be creative. And so we really kind of have had to look at what can we do to limit exposure. In ER, you may be coming in for something as simple as a broken leg or a heart attack. And someone that's coming in for symptoms of coronavirus, we don't necessarily want to put you in the same spot, same location. We want to look at how can we delineate, right, and have everybody still receive the same care. So we talked for a long period of time on how we could do this effectively. So we built a tent. And so our tent is not a testing center. It truly is a separate area to triage patients that have symptoms of COVID. So they go through the same registration process, the same triage process, they get the vital signs the same way, and then they enter the ER through a different location, and it's just an easier access to our rooms that are dedicated to these patients, our negative pressure rooms, and get access to our provider.
So how do they find out? So tell me the process whereby someone is sent to that tent. First of all, they, if they're having symptoms, they contact their healthcare provider?
Absolutely. That's always your frontline defense, is to go to your primary care. And once, that is not an option, or if you don't have a primary care and you've exhausted your resources, or if it's just a medical emergency, we are the front door. So when you come to our front door now, we just have a screener there. We have a nurse that is greeting our patients, doing a quick screening process to see, why did you show up? Do you have a cough? Do you have a fever? Are you short of breath? And if they meet any of that screening criteria, then they head to the tent. If they don't meet that screening criteria, they head through our front door to that triage area.
Do you want patients to, if it's possible, to call first? If the symptoms, if it's possible to contact the hospital before going, is that what you'd rather the patient does?
It's always nice to have a heads up, right? So we can help guide them, because it can be confusing, to walk into one entrance and why is this tent here? So we do always encourage, if there's questions, we're here to help. One of the things we have, though, that is really nice is that if they've called their primary, or they don't have that primary care, we have access to our medical group, and they can give guidance as well. We have Anytime Care. And so Anytime Care is an app you can get on your phone. You can access it online, and you can actually go on there and get some guidance. So you may not need to come into the emergency room, and they can guide you. They may tell you to go directly there, and we do have signage, and we do have staff to help people through that process.
So is that the virtual MD that we hear about?
It is. It's very cool. We have a really awesome support system with our med group. We've been this is not new, Anytime Care. It's just that we now are using it a little bit differently. So they actually have a free COVID screening on there as well, which is nice. It's allergy season, right? There's a lot of other things that can mimic some of these symptoms. So it's nice to have a professional, a provider that can guide you through.
So where do they look this address up? The web address.
Yeah,
for that?
there's a link, on our St. Elizabeth's website, but they can also type right into the Google spot Anytime Care, and it'll pop up, and then it's really easy. It's very user friendly to guide through.
So you're also the manager of the emergency department as well as urgent care. What can the public do to stay safe and also keep our healthcare workers safe?
I can give you the routine answers of wash your hands and stay 6 feet apart, to be mindful of touching your face. But really the key is staying home. If you don't have to be out, stay home. It's really hard right now with the weather being beautiful and wanting to do yard work and, head to Lowe's or Home Depot and get your next project. But honestly, staying home gives my team the best chance to beat this. This virus needs a host, right? It needs someone to be on, to live through. So the only way that we can stop this is truly to stay home and limit the exposure.
Herb, do you have any
Yeah, Aaron,
questions?
again, thanks for coming in
thank you.
and your busy schedule. I know what you do. Can you talk about your staff? I know you said that you've got a great staff, but what kind of toll is this type of situation taking on your staff?
My staff. My staff's my family, 100%. I'll try to keep my composure because I'm pretty proud of them. But, it's scary. It's scary to definitely face a pandemic, right? Those are words that I never thought I would even maybe say. We have an amazing system for all the way from our senior leadership down that supports our nursing staff. I'm very proud of it, that we're very educated, informed, they're transparent with us. There's a lot of anxiety, and we talk it through every day, sometimes 10 times a day if we need to let them know that they're supported not only by, the tools we give them to do their job, but emotionally and mentally as well. We have brain checks quite often just to make sure everybody's here with us. I tease them often that, when we're in a heightened situation, even like in a cardiac arrest, I always say, okay, guys, you have to check yourself here, right? You have to check your pulse rate so that we can do what we can for this patient. So we're doing that same thing from a mental standpoint as well. Where are you at today? We have an amazing program called Wings, which is fellow nurses and colleagues that just have gone through specific training for this to just really support people that have been in tough situations. So
For when somebody has that meltdown that you're talking about, because it can happen with this going on.
we're human, right?
Exactly.
Absolutely. So we all have families, and and we want to make sure that we keep not only our patients safe, but our community safe. A community that's supported us like no other. Again, trying to keep my composure a little bit, but it's been amazing to really see how much they've reached out, and it definitely helps. The high fives, the virtual ones, definitely pay off in the long run for us.
That's good. One thing we get a lot of questions about is where can I go get a test, and why isn't everybody being tested? Can you
Yeah, absolutely.
comment on that?
It's hard, right? There's criteria that the CDC gives us guidelines on that. If you're not symptomatic and you don't meet that criteria, you're not going to be tested. So as much as we would all like to be, proactive and preventative and know who has it and who doesn't, the reality is that we really need to find out who is symptomatic and how we can best care for them and test them as well.
Well, that's good. I think that answers the question because we get that all the time. Why can't I go and just get a test? And again, the lack of test kits, we heard that for several weeks now, and hopefully that's going to get better. But still in all, you have to have those symptoms in order to get it. So we appreciate all that information.
Absolutely.
I'm sure our viewers really appreciate you coming in today.
Thank you for having me. I appreciate you guys supporting us as well. The health department's been key in helping us through this crazy event. So.
Thank you, Erin.
Thank you.
Erin's from HSHS, St. Elizabeth's Hospital. Thank you for being here
Yeah,
today.
thank you.
So, as we just talked about, shortages of supplies has been one of the big problems during this pandemic. This morning we had a conference call with our senators and our state representatives, Representative Hoffman, Representative Greenwood, Representative Wrights, as well as Senator Belt, Senator Schimpf, and also Representative Charlie Meyer were all on the call. And this afternoon, or a little earlier today, we received a couple shipments of our personal protective equipment that we've been asking for. It's not everything we've been needing, but it's certainly enough to be able to get out to our first responders and agencies in the area to make sure that whatever we have, they have, so that we can fight this, that we can be armed to fight this virus in the best way possible. Another public servant who is certainly always looking out for the public and how to help things is our St. Clair County Treasurer, Andy Lopino. Andy joins us today. Andy released a press release a little earlier, and he's going to talk about the delay in property taxes due in St. Clair County. Andy, welcome.
Thank you. Thank you for putting this on, Chairman. We certainly appreciate it. Been watching every day. We know that families are struggling during this time. Our business owners are struggling during this time. And so today we took some action and we issued this press release as it goes about regarding property taxes. Typically we would mail in early May with those due dates being in June and August. We're going to delay that by at least a month. So today we announced that the 2019 real estate property tax bills, which are collected in 2020, we're going to mail those out around June 15th, with our first and second installments being extended to July 30th and September 30th. And then in addition to that, we're working on a resolution for you and the county board to take up that would delay that first installment penalty through August 31st. And so by doing that, we're hoping that we can still, we bill, we collect taxes, and then we distribute that money to our schools, to our local authorities, our libraries, our firefighters. And so what we're encouraging people is that those who haven't been as impacted, those who might have the means, we would encourage them to try and make that July 30th deadline for the first installment. But if, we know there are people struggling, so that's why we're going to ask the county board to also take on a resolution to delay that till August 31st. And as soon as we start collecting and we get money in, we will distribute that money out to all the local authorities that need it.
So some have asked, why not just get rid of the taxes for a year? And as you just explained, when those dollars are collected, the county doesn't keep that money.
No.
The county distributes those funds through the municipalities, the police, the fire departments, the volunteer fire departments. Everybody looks for that funding every year. Their budgets have already been set, and they're counting on those payments. Normally, we make a couple payments a year as the money comes in from the taxes. So every governmental entity will see a delay in getting their money, but that also gives people extra time to gather their finances and pay those.
And like we said, the county, we're operating, a lot of us are operating remotely, so we're still reaching out to some of our taxing districts. But we are required, once my office collects that money on a monthly basis, we're supposed to disperse that back to those firefighters and local districts, but we typically increase that. So as soon as we start getting money in, we're hoping that every week and a half to 2 weeks we're going to make disbursements so that these local districts aren't negatively impacted by this decision.
Great. Andy, tell me a little bit about how you're able to keep your office running during this time. You people working from home?
Yeah, we have a handful of people that we've gotten them access to work from home. So if people are needing a refund, or if we are making checks, we are talking to people. I'm in the office daily, returning phone calls, answering phones. One thing is our mobile home bills went out earlier in this year. And so we've had a lot of people call asking about how they can pay, and so we just let them know how they can reach us. Most of the time we accept mail payments, but we are staffed during the day to answer phone calls. So we're still operational to help others.
And I think we're going to try to work together to extend the mobile home payments also.
Yeah, we're still in that process. Mobile home bills again went out earlier in the year, and that due date for them is June 5th. But hopefully we can work with the county board to extend that a month for them as well.
And we'll be doing both of those extensions at the St. Clair County Board meeting the end of April, which we'll be doing probably a lot by phone, but certainly the courthouse will be open if anybody wants to witness, but we'll certainly make that available to people. So it's an open meeting, but in order to get this important business done, the state will allow us to do it over the phone.
Yeah, that's perfect. Yeah, so we're open. If people have questions, please call us. We're still operational. We'll do our best to help answer anyone's questions that they have as it relates to my office and property taxes.
And the switchboard at the courthouse is open from 6 a.m. to 6 p.m. Every day, and it's 277-6600 extension 2201.
Call us. We're happy to help.
Great. Thank you, Andy, for being here. We really appreciate you coming in today.
Thank you, Chairman.
Mr. Simmons?
Thank you, Chairman. Appreciate that, Mr. Lopino. I'm sure our viewers appreciate that information. A little bit on the EMA side, the conference call this morning with the hospital EMS services went okay, gathering all that information, and that's great, and networking, keeping us all in the loop and updated. As you heard the chairman say, we had a conference call with the state representatives and senators. I can't speak enough for Latoya Greenwood and all of them, Jay Hoffman and all of them. Just when we call them, when you pick up that phone, you're pushing the right buttons to get us what we need. We got that shipment in today. We've already had 23 of our first responders departments come in and pick up much needed items that they needed. We'll be putting together a list to send back off to the representatives to make sure that supply keeps coming. I wanted to say that it was good news today, your due diligence and your pushing to get the zip code issue taken care of. It may not be exactly what we were looking for, but I think it's a step in the right direction. So again, thank you for at least addressing that's been a topic of conversation on these briefings. So we really appreciate you interjecting in that. I had a personal situation last night. I finally got to get home for a while, but on the way home I see about 12 young girls ranging from the age of probably 12 to 14 walking down the street. I stopped and said, "What are you doing out here?" And of course 12, 13, 14-year-old young ladies had their attitude. The one young girl says, "This is my best friend, and if I'm going to die, I'm going to die with her." And I got to tell you, I got a little upset. Parents, if your kids are out walking around in groups like that, if you have not explained to them what's going on by now, shame on you. Those 12 girls that was out there walking around should have been at home, and that's where they ended up going. So please stay at home. Tell your children to stay at home. If not, I guarantee you they could become a statistic, and then you're going to be wanting to know why somebody didn't tell you. It's time to take this serious if you haven't done that yet. So please stay at home. Stay at home. You've heard us all say that. We'll be back tomorrow afternoon, approximately around 3:30, with another daily briefing. We'll be back shortly with our ladies to translate this into our Spanish communities. Thank you.